Right, hello everyone. Thank you very much for inviting me. Right, so let's see how that works. Okay, the other way. So I will talk to you about outcome measures in vitiligo. I'll tell you all about it. It's a bit of a behind the scene research. So I can see some familiar faces in the audience. For people who don't know me, I've been doing vitiligo research since 2009 when I started doing my PhD, and since then I've been actively involved in vitiligo research, which I really, really enjoy. So I will tell you about the outcomes, the outcome measures, as well as what exactly is the problem with vitiligo research and why the research is going that slow. Right, we all know that vitiligo is the most common depigmentation disorder affecting thousands, hundreds of thousands of people worldwide. However, despite the fact that it's been 50 years of research and over 90 interventions been tested, we still don't have cure and no firm clinical recommendations. So we all know that to help patients, doctors make decisions about treatments. Treatments are developed and tested, evidence what works best and is safe. To do this, researchers looked at the effects those treatments have on patients. This is done by measuring an outcome. Let me give you an example. So an outcome is how fast you get your color back in your white patches. What are the side effects before or during the treatment? How long does it take you to perform the treatment? This is an outcome. This is what we measure in a trial. So an outcome measure is how we measure it, which is basically a scale or a ruler. For example, the percentage of repigmentation, the number of patients who achieved 50% of repigmentation of the white patches. So why is that all important? And it's kind of a difficult topic to understand. When I was doing my PhD, when I started doing it in 2009, I didn't realize how important outcomes were when I actually came across this paper. I was actually shocked to see that 85% of research money and also time is wasted. 3 out of 4 reasons for that are related to outcomes. What exactly? So important outcomes are not measured. So we're measuring something in a clinical trial and we don't know whether it's important or not. Clearly, in some occasions, it's not. 50% of planned outcomes are not reported. So if I'm doing a trial and I'm thinking to report 3 things to you after I finish the trial, but then when the trial go on, I can see that, okay, it doesn't go that well. There's only one, good thing to report because the other 2 outcomes I want to report, they didn't show that my treatment was effective. So I'm just not going to report it. I'm just going to report the good one. I'm going to hide the others which didn't show good effect. Unfortunately, that does happen in research. And the third one, perhaps the most important, is that because we are measuring different things and using different scales, we can't combine trials. We can't really compare what works best, which is called meta-analysis. So that's why we need the core outcome set. This is not only for vitiligo, not even only for dermatology, this is generally for every medical research. So what is a core outcome set? It's a minimum set of outcomes that all researchers internationally agreed that we will measure these 3, 4, 5 things in every trial, and we will measure it by using that specific scale. Why do we need that? Because we can then combine all the trials and see which works best, which treatment works best. So let's look into what's happening in vitiligo. So unfortunately, we have the same problems as in every field of medicine. So there is no agreement on what we are measuring in trials and how we are measuring it. Let me give you an example. So in study A, researchers are measuring the pigmentation, which is when you get your color back, by using the percentage. And in study B, researchers also measure pigmentation, but they use centimeters to report their results. So a few years ago, myself and my team, we did a review, and we looked into what outcomes and what scales are used in vitiligo trials. So we looked into 54 trials only, and we surprisingly found that 25 different outcomes were reported. Yes, 96% of the trials did measure pigmentation, but almost every trial invented their own scale to measure that pigmentation, which means that if I wanted to combine the trials and see which treatment works well, I wouldn't be able to do that because I would be comparing apples with pearls. And the other important thing which we found out was that repigmentation was assessed by patients in only 4% of the trials. So actually, we asked patients what they think about the results of the treatment in only 4% of the trials. So the rest we did by ourselves. So that's when INFO for vitiligo was created. So INFO stands for International Initiative for Outcomes for Vitiligo. It is an international group of clinicians, researchers with interest in vitiligo, and patients with vitiligo. So both myself from the UK and Professor Khaled Ezzedine from France, we are leading the group since 2011, and we have collaborators in 24 countries worldwide. So we have around 100 participants. So, and of course, the most important part of the participants are patients. So why is it important to involve patients in outcome decisions? Well, first and foremost, you as patients have insight into everyday challenges of living with the condition. And also, you guys can tell us exactly what you think is important for us to measure in clinical trials and how to measure it. So I'm very happy to report that since 2011, we did lots of progress into the behind-the-scene research for vitiligo, trying to create a consensus. So in the future, all trials measure the same things and using the same ruler to do it. So we have now achieved the core outcome set, which, as I mentioned before, it's a minimum set of outcomes. So we all agreed internationally that we're going to measure these things in the trials. So what we did next was to look into how we're going to measure pigmentation, the most important outcome of all, of course, for everyone, including patients and clinicians. So we did several workshops in the US. This picture was taken in Detroit on a patient, on World Vitiligo Day with a patient support group from Detroit and US. And also we did 2 other workshops in US, as well as a few meetings with clinicians in Singapore and Paris. So what we come up with after this major project was that we have a unified scale on how to measure pigmentation, which is the first one here. But the most importantly, we came up, and that's because of you, because of the patients told us to do that, is we think that measuring pigmentation does not only have to be objective, it needs to be subjective, because beauty, as well as the pigmentation, is in the eyes of the beholders. And I will tell you why that is important. So have a look at this picture here. So we have here the boy who, if I was a clinician doing the research, I would say, look at that, he had 100% of repigmentation. That is amazing results. However, you can see the color match is pretty bad. Yeah, and we all know that perhaps he will be transient, which means it will fade away eventually. But we need to know that. We need to tell that to the patient that, you know what, you'll have your phototherapy session or whatever treatment that results was given by. But after that, you will have 2-3 months which your vitiligo will actually look worse. Are you happy to do the treatment? Yes or no? You know, at least, guys, you're informed and you know what you are expecting from the treatment, instead of just saying 100% pigmentation around the eyes. That's an amazing result. Well, maybe not. So, and look at the other picture. You have here that enlarged patch over there. So that patch was wide before. So you can see there's some islands of repigmentation inside, which is perhaps over around 75% of repigmentation, which is again a great result if you say it objectively. 79, wow, that's amazing. But you still need to cover that up. It's still visible, and perhaps even worse to cover up, isn't it, if you were about to cover it up, because the color match again and the eyelids are not homogeneous. So it's again in the eye of the beholder, isn't it? So we do need to ask our patients what they think about their pigmentation, not just measuring it in percentages or centimeters. So that's it. That's a short summary of behind-the-scene research on outcomes and outcome measures in vitiligo. So we are still continuing our work, and we have lots of things coming up. But I think with your help as patients, and we want to ensure that your voices are heard, which I think we have achieved so far. So thank you very much for listening to me today.